I like to use jumbo biopsy forceps on a routine and regular basis. It is my go-to forceps. I firmly believe that tissue is the issue. I believe that if we're going to take the time to do endoscopy and collect tissue, that we should do it right and do it once, and therefore I use jumbo forceps. Jumbo forceps allow the collection of the most tissue, both in volume, surface area, and depth. It does it in a reliable way and a reproducible way. The landscape is now changing in GI endoscopy. We're changing now from fee-for-service to fee-for-outcomes, actually, and it makes even endoscopy so much more important. The primary reason why we do endoscopy is really to collect tissue. And the most commonly used instrument in endoscopy is biopsy forceps. And therefore it's crucial that we gastroenterologists who do a lot of endoscopies in particular really pay attention to how we take biopsies and to make them count.
In pathology, it's all about how much tissue you have. So any technology that puts more tissue on the slide for us is always going to be an advantage. In particular, there's obviously a very wide spectrum of disease in gastroenterology. So both inflammatory and neoplastic diseases, and all of those require as much tissue as possible.
The representative specimens that you obtain with jumbo biopsy forceps, we have shown in past studies, give 3 times the volume and more than twice the surface area, so that you are able to assure the patient and assure yourself that you're doing the best job you can.
The two instances where we see inadequate biopsies are large lesions that you're looking for invasive cancer and submucosal lesions. And we find the jumbo forceps can sample both of those better than the small ones.
I had a 65-year-old woman who, for some reason or not, had not had a colonoscopy despite her many requests from her primary care physician. She finally came to us and had a colonoscopy, and lo and behold, she had several rectal polyps. We biopsied them and removed them with jumbo biopsy forceps, and they were carcinoid tumor, and more remarkably, the pathologist told us that it was a complete resection. I find this sort of anecdote very useful because you really don't know what you don't know, and until you collect the right amount of samples and you make the right diagnosis, it really behooves you to use the right instruments. I thought it was interesting that she then sent me a thank you note, which I was very touched by, and she just said, "I just wanted to thank you for taking good care of me and removing the polyps. I am so thankful I didn't take no for an answer this year. I've been asking for a colonoscopy for at least 10 years. So she really is quite grateful that these biopsies and getting adequate specimens made an impact on her life.
The impact financially of inadequate specimens is that that patient has to come back and incur another endoscopy. The cost associated with that runs from $1,300 to $2,200 in our community, plus the laboratory fees, which run from $378 to about $550 on average per patient. So you're talking a lot of cost associated with bringing that patient back. And the jumbo forceps has reduced the callback rate for these inadequate samples. And again, these are predominantly neoplastic samples and submucosal samples.
Jumbo biopsy forceps helps with cost containment since it allows us to collect tissue in an efficient way, perform procedures in the least amount of time possible, and collect adequate tissue specimens so that we don't have to repeat a procedure if we don't have the diagnosis.
Boston Scientific is an excellent partner with our hospital. They've actually helped our hospital become a 5-star patient experience. Our Boston Scientific rep is actually a great resource to the team, a great resource to the community and to our patients, because one, they're able to provide us the data that we need. Two, they're able to provide educational services to our staff, and they're great communicators in regards to patient safety, quality of patient care, and provide in-services that allow us to give to our patients.